And diabetes insipidus does not have any cure necessarily. They're not able to cause your body to start producing this hormone, but there are things that they can do to treat it so that you're able to produce the right amount of urine and things like that. One interesting thing here, though, is that alcohol suppresses the ADH production and release. And so when someone drinks too much alcohol, that causes ADH to stop being produced, and so that's why they produce a whole lot of urine. And that's also what leads to what they call the next day, what do you call the hangover? So if you have the hangover, that hangover is actually caused by dehydration. So because the ADH production is inhibited, you're producing a lot of urine, and so your body becomes dehydrated, and you get that headache the next day, and other things associated with the hangover. Okay, the other hormone, oxytocin, also produced by the hypothalamus and stored in the posterior pituitary gland. So it causes uterine contractions during childbirth. It causes milk letdown when a baby is nursing, and it's controlled by a positive feedback. So this is one that because of those uterine contractions. So those are the two hormones that are produced and stored in the posterior pituitary gland. There's a little video here on the PowerPoint that I encourage you to look at, because it talks about the hypothalamus and pituitary gland and how they're associated with each other and how they release these hormones. Okay, let's look at the anterior pituitary gland right here, so that we were at the right place. So these are the hormones produced by the anterior pituitary gland. Thyroid stimulating hormone stimulates thyroid. Adrenocorticotropic hormone, ACTH, which stimulates the adrenal cortex. We have the gonadotropins. So there are two of these. There's the follicle stimulating hormone, FSH, and the luteinizing hormone, LH. Both of these are produced in males and females, although when we're talking about the follicle stimulating hormone, that's related to the production or the release of an egg in the female reproductive system. There's also prolactin, which stimulates milk production, and then there's growth hormone, which is related to the growth of an individual. So growth hormone, let's talk about that just a little bit. So in many of these hormones we can talk about what happens if you produce too much, what happens if you produce too little. So in the case of growth hormone, if you produce too little, then you have what's called dwarfism. And that's mainly in childhood. So if someone is not growing like they're supposed to, when they're still young, they can give them growth hormone treatments to help stimulate that growth. However, once an individual, as we talked about in the skeletal system, once those growth plates are fused, they become growth lines, then their growth, their stature is set, so they would be a dwarf throughout their life. If you have too much growth hormone, you get you become a giant, so you can grow too much. Here's a picture of a guy that has a lot of growth hormone and one that didn't have enough growth hormone. You can see obviously the huge difference there. This last one, acromegaly. Now this is an interesting situation where you're producing too much growth hormone, but this is after you're an adult. So this means you're not going to get any taller. But what happens is that the bones of the face will expand, the bones of the body will get bigger and expand, but you won't get any taller. They call this acromegaly. And this is a picture of an individual that had acromegaly after they reached adulthood. Their bones continued to grow and develop, although they did not. So one of the things that can cause this overproduction of growth hormone is a tumor in the pituitary gland. And this can happen when they're young and become a giant, or this could happen when they're older and cause acromegaly. A tumor can develop, and then your body starts producing all this growth hormone, and it leads to acromegaly. All right, so those are the hormones, or that's the hypothalamus and pituitary gland and the hormones associated with that.